I'm Charles Friedman. I am the chair of the Department of Learning Health Sciences in the medical school at the University of Michigan, and also a professor of information and public health at the University of Michigan.
So what are your thoughts? What are the key challenges you think that health informatics is facing at the moment?
Well, there are a lot of them, and it's hard to cone down on one or two, but since you asked, I will try to comply. So there's certainly in the U.S., and I would guess around the world as well, there's a lot of interest in getting clinical decision support right. One of the concerns in the U.S. at the time, but by no means the only concern, is this notion of over-alerting and the idea that people are getting too many decision support messages and then ignoring them, and then becoming acclimatized to the idea that they're going to get many messages that they're going to ignore, which leads possibly to ignoring messages that shouldn't be ignored. So it's one thing to talk about this problem, it's another one to do something about it. And as I've thought about this over the years, I have actually thought that our approach to decision support is actually simplistic in a key way. And that is, our decision support systems don't model what the recipient of the message actually knows. And that, of course, means that everybody gets the same messages, the same clinical triggers will trigger the same messages to every recipient. But in fact, if the system knows something about what the intended recipient already knows, then it's quite possible that messages that will be redundant or repetitive will not be sent. So I'm thinking that something the field really needs to work on, and we could take a cue for how to do this from the science of intelligent tutoring systems, which do, in the educational domain, actually include a model of the learner. Intelligent tutoring systems do have a representation at any given point of what the learner already knows. And in the same way, perhaps by looking at clinicians' past behavior, or the history of messages they have received, or the history of the actions they have taken in response to messages that they have received, it should be possible to develop a model of each recipient in a clinical decision support scenario in a particular environment, and make, in effect, our decision support systems smarter and more discriminating and targeted in the messages they send. So that is one big challenge, I think, that is facing the field right now, certainly in the U.S.
And what do you think organizations like BCS could be doing to help health informaticians?
Well, this is a deep computer science problem. Modeling anything in a sophisticated way and creating computational methods that are scalable and adaptable to a wide range of situations is something that has the hallmarks of a serious computer science problem. And I think the best minds in computer science, drawing on models and methods that exist, really need to come to bear on this problem if we're going to solve it in a way that is really effective and broadly implementable and scalable.
And while I've got you here, what would you say the main differences are between the US health informatics sector and the UK health informatics sector?
Okay, well, I'm going beyond my knowledge base here, or right to the brink of it. I've been told, and I can only go by what I've been told by my colleagues here in the UK, that unlike the US, they tell me that historically a lot of the the really sophisticated work relating to health information technology has actually been done inside the government and inside the NHS. And while there are obviously some very distinguished and excellent people in British universities, and I know many of them and have great respect for them, my sense is a lot of the actual work has been done in the NHS, and this goes back many years. In the U.S., by contrast, the government's involvement, and I worked in the government for 8 years, so I know this firsthand, with health information technology is a rather recent phenomenon, and the preponderance of work in medical and health informatics has really been focused in the universities, and there is now a rich and vibrant academic community in health informatics in the U.S., and I believe that exists in a more mature and developed form than it does in the UK. I'm not sure who would agree or disagree with me about this statement, but it certainly is based on things that I've been told.